We entered into a contract with the government and the CDC as an organization to do 40,000 long-term care clinics over the next 12 weeks. And now we've already gone through actually a couple weeks. So really we're down to about 10. And then in California alone, we're looking at doing about 15,000 long-term care clinics. So we're actually sending folks there and we're going to do all the vaccinations for them. What we're doing, California actually gets to make those decisions, right? Who gets vaccinated first. And so long-term care facilities are actually, the first up in California. We'll call it phase 1A. And so again, as a part of the contract with the government and the CDC, we're doing the long-term care facilities. And so we're first up to go into those sites. And we actually have what we call depot sites, which are sprinkled across the Bay Area, where we're actually storing the vaccine. So our team goes each morning, picks up the vaccine from the depot site, and takes it to the long-term care facilities where we then vaccinate that entire long-term care facility. The cool thing is we are going to each long-term care facility 3 different times. So we go there for the initial dose. We go back 3 to 4 weeks later for the booster dose. And for anybody that we may have missed the first time around. And then we go a third time again, just to make sure, right, that anybody that we vaccinated the second time around, that we get them their booster dose on that third. So we're making sure that we don't miss anybody. Yeah, so we are actually going, like I said, 15,000 clinics in California alone. And we started last Monday, which was the 28th. And in 12 weeks, 700,000 patients, as you alluded to. The thing is, we've been planning this since October. So we learned so much from our testing, right? We scaled up very quickly, and we've tested for COVID more than 10 million patients. And so all of those learnings, I guess, kind of came together, right, and coalesced into a very clean strategy to make sure that we can vaccinate these LTC clinics very quickly and easily. And so we began staffing efforts long ago. We have, again, those depot sites, right, where the vaccine was going to be dropped. And again, these teams that we've put together, each morning, again, go to each depot site because they're already staffed and ready to go. They pick up the vaccine, they go and vaccinate, they do one clinic, they may go and do another clinic. But again, we started this process so long ago and started planning the staffing pieces back in October. So we're ready and doing a really nice job already. When you think about 15,000 clinics, that's 7 days a week. We have appointments lined up. So, in theory, it's going to take about that long. We may be able to end a little bit quicker as I look out on the horizon. But again, between getting to all 15,000 of those clinics and making 3 repeat trips, we've got our plates full, but are executing at a high rate right now. The long-term care facilities have been just incredible partners with us from the start, right? So we're in contact with them very early. They are actually in charge of consent on their end. And so, right, if they can't necessarily get the consent from the patient, they're going to work with next of kin or, whoever, I guess, is helping with the actual healthcare of that individual. But again, the long-term care facility takes care of the consent. And again, once we get there, it's kind of a ready process where we're then vaccinating each individual one after the next. I think about this on a daily basis. We're going to be able to bring hugs back is the way that I think about it. And I have actually seen, right, up close and personal, as our teams are walking into that long-term care site, you can see that there's actually folks that would like to go and visit, right, their residents that are in the LTC, go see their mom, dad, brother, sister, but they can't. But they're excited and there to cheer us on because they're so excited to, again, get in there and at some point in time, start to bring hugs back. So yeah, this is so important. And I think about, we're a healthcare transformation company, and our objective is to help people on their path to better health. And again, bringing hugs back, getting humanity back on its feet. It feels really good. So a great example is we gave 20 million flu shots this year. That's double what we did the year before. So again, I think it just shines a light on our ability to scale up. And we are anticipating that we're going to be able to do 20 to 25 million vaccinations each month once we hit the general public. So while maybe not at this high scale yet, we have proven time and time again, like with testing and other things, that we have the capabilities to do it, and we'll be able to deliver. So we're excited about the opportunity. I think this is, again, you look at CVS, we've gotten out into the community since the pandemic and done testing and scaled up quickly, right? To just, I guess, help drive and deliver safety. And now we get to get out there, right, as healthcare professionals and vaccinate to bring humanity back to its feet, as I keep saying, or bring hugs back. It's a special organization. And I just posted recently on LinkedIn, just how much joy it brings me getting out every single day to do what I do. So again, I think we're just really proud to be a part of this work, and humbled and privileged at the same time. You nailed it with saying that, California really is in control of the phased approach, but I can tell you that we are going to be a part of every step. So kind of as we learn, as things go, we're going to jump in and get involved. Like right now, we're anticipating that we're going to be able to vaccinate the general public in March. And so we're going to be ready for that. We are going to be appointment-based only. So you can easily go on to cvs.com or onto our app, or use our 1-800 number if you don't have a computer or smartphone. And you'll be able to make an appointment for your 2 doses. And then we'll send you many, many reminders as well to make sure that you come back. But yeah, we're going to be an integral part in every step. Yeah, it's going to be no cost to anyone that wants the vaccination. I think there's a sigh of relief for everybody when they hear that. Vaccine costs money, of course, but the government's going to cover that. Administration, which is our pharmacists giving that vaccination, usually has a cost, right? And that cost will go to the insurance companies who will cover it. If you don't have insurance, there are state-funded and government-funded programs that will cover that cost for you. So no cost for this vaccine. Yeah, so again, you're right. The Pfizer vaccine is kept at ultra low temperatures, and so it is actually shipped and stored on dry ice in very specific shippers. And then again, we take them out of the shippers, and they're not at such a cold temperature anymore, and stored until again picked up at the depot sites. And then taken, of course, right, then we're starting to arrive towards room temperature. And just like any other vaccine, right, we're going to administer into the right or left arm, just like a flu shot. But again, it is no longer those ultra frigid temperatures once it enters the arm. No concerns about waste. We have very specific protocols in place, and the timing we actually take it out of the shipper, the time that it's picked up, and then the time that it's taken to the long-term care facility. So there are no issues or concerns about waste for us once we're taking it to the long-term care facility. as a healthcare professional, I can, share my thoughts from, me to you. I think everybody needs to get vaccinated. Yes, the process of FDA approval went a little bit more quickly, but that doesn't mean that it wasn't exhaustive. And when you think about this, the FDA has safety and efficacy at the front of its mind when it's making decisions, right? And again, if we want to get humanity back to its feet quickly, everyone needs this vaccine as quickly as we can get it to them. So rest assured that it still went through an exhaustive process, and me as a healthcare professional would recommend it.